I'm Dr. Chandra Sekhar, Gastroenterologist and Advanced Interventional Endoscopist. I trained and practiced in UK for 20 years, currently practicing in KIMS Hospital, Hyderabad. Today, I'm going to talk about a gallbladder disease, gallbladder stones. Let's talk about the functions of the gallbladder. Before we start that, I would like to know where the gallbladder is. As you can see, this is the liver, and I would like to show you what the function of the liver and the function of the gallbladder is. The liver produces this yellow substance called bile, and this is normally stored in the gallbladder, and then when you eat food, it contracts and then pushes the bile into the small bowel. Sometimes the gallbladder holds stones. This is because the bile and cholesterol, they sediment together and form stones there. Majority of the time, it doesn't cause any symptoms. And if it does cause symptoms and it's been frequent, we need to take action about them. When the stones are formed, they sometimes can block or cause infection within the either bile duct or in the gallbladder. This can cause pain, nausea where you feel like vomiting. As it blocks the flow of the bile, when the stones come into the bile duct, it causes jaundice and patients feel bloated or pain in the shoulder or the back, various presentations. So I'll just show you an animation picture to suggest what happens there. Just for your understanding. So this is the gallbladder and that's the liver. And when the sediment forms the stones, they do come down sometimes into the bile duct. As you can see, that's flowing through, and then when it comes and blocks the bile duct, the yellow bile doesn't flow through into the small bowel and then gets blocked up into the liver and back into the circulation, giving rise to what you call the jaundice. As bile duct is blocked, the infection do come in those one, what we call as cholangitis or cholecystitis. And these patients develop those symptoms I just described. They get pain in the right upper quadrant, or shoulder pain or the back pain, vomiting, being sick, unwell. These are the presentations. The next one is, most commonly people ask me, why did I get these stones? Or else what we call this is, what are the risk factors? Anybody can get these stones, but primarily we see this in patients who are females in their 40s and they're fertile and they tend to be obese, fat. So we call them 4Fs. So they're females in their 40s when they're fertile and they're fat. These are the people that they are relatively high risk of developing these stones. Majority of the people do get pain in the tummy, and they ask me, how can I get diagnosed for the stones? The common test that is used is when the clinical probability of gallbladder stones are there. We do blood tests, primarily looking for white cell count, which we see the raised white cell count infection markers. We do liver function tests. Sometimes we do pancreatic tests as well. The stones can block the pancreatic duct and then cause pancreatitis. So we do MLAs. And also look for inflammation markers like CRP. And we also need help from the radiology to see if this confirms the stones in the bile duct, which can include simple tests like ultrasound, CT scans, MRI scans, and we can also diagnose by endoscopic ultrasound, where we put a tube down the throat and we send some sound waves just like an ultrasound, and then we can look at the bile duct to cause that and to find out the stones are causing the blockage to the bile duct. Once we confirm they got the stones, depending on where the stones are, how do we treat them? So first of all, are they symptomatic? If they're symptomatic, how frequently they are symptomatic is a big question. Because a lot of the times I get phone calls to suggest like, okay, we did the scan, we found the stones, should we operate? If they're asymptomatic, I just tend to leave them. And if they are symptomatic, then we find out which part of the stones are. For example, if they are in the gallbladder and not causing the blockage to the bile duct, we tend to refer them to surgery where they take off the gallbladder, which is called cholecystectomy. If they are causing blockage to the bile duct, we need to take those stones out from the bile duct first before we go for surgery. I'll just show you an example. We have a patient where the stone is almost like 2 centimeters, which is the size of a lemon. So let's see that. This is myself removing a large stone from the bile duct. And we go through the mouth. What's a procedure called ERCP? We feed the wire through, and then you can see this white structure here. That's a big stone, almost like 2 centimeters. I'm using the basket there where I'm holding the wires across the stone and crushing them so that they become into small pieces and then grabbing them out. That's called basket treatment for these big stones. Normally we use the balloon to scroll it down. Okay. So the treatment could include surgery for the gallbladder, taking out, called cholecystectomy. If you got a stone in the bile duct, we do ERCP to remove that. A lot of the times patients do ask me, what should I have done or what should I do to prevent the stones coming back? It's difficult to answer. Nobody knows this, but general advice, lifestyle modifications are relatively better, which include regular exercise, plenty of water, reducing the fatty foods would be useful. Also, one of the other questions do ask me is those patients who does not have symptoms and has stones, they will ask me, what should I do? Should I take any medication to dissolve the stones? Scientifically, there is no medication that can dissolve the stones, but there is one medication called ursodeoxycholic acid, which reduces the density of the bowel so that the stones can be dissolved. So these are the things I would recommend. So lifestyle modification, and people who are asymptomatic has smaller stones could use ursodeoxycholic acid, but the medication has not got any scientific evidence. Thank you.